Dr. Süleyman Yildiz is a pediatrician in Mardin, Turkey. He's a past executive committee member of the Association for Medical Education in Europe. Apart from daily clinical works, he is actively working on the medical education activities. He previously worked as the European Student Representative at the European Parliament and as a Secretary General at European Medical Students Association. Dr. Süleyman would be presenting to us basically the topic on effect of asymptomatic heavy metal poisoning on adolescent health. And then moving on to also another topic, which is the neonatal lupus erythematosus with a cutaneous nevus case. Welcome, Dr. Süleyman.
Hi, everybody. I'm regulating
Hello.
my presentation. Sorry, give me a few minutes.
Sure.
Yes, we can move on here. Hi again. I'm Dr. Süleyman Yildiz. And thank you for Dr. Nadine for the nice presentation. I'm a pediatrician and also PhD on medical education. Today we are going to talk about the evaluation of the heavy metals level in blood, plasma, and urine of adolescents with aggressive behavior. Later on, we will talk about the neonatal lupus syndrome. I was planning to make it interactive when I prepared it for interactive method, but because of the short of time, I will miss this interactive sessions, but we will conclude that on the question part. Let's continue on that. Here the picture of me at the right side. This is me. This is my AMI team. AMI is Association for Medical Education in Europe. It is the biggest biggest medical education organization in the world. Each year we hold around 4,000 participants and holding a conference about medical education. I invite you, all of you from the site, and this year's will be online again because of the coronavirus. But next year we will be in Glasgow, and I hope we will meet in face-to-face together. And this picture is from the London, where I was with my team. I was in executive committee for 4 years, and later on I was the ambassador of the Turkey for 3 years. And as I said, on behalf of this presentation, it is my pleasure to invite you for the next AMI conference as well. Let's continue on about the heavy metals and its effect to the adolescents. I have special interest on adolescents' health as well and the heavy metals. As you know, asymptomatic heavy metals poisoning causes non-specific symptoms such as behavioral disorders in children, difficulty in learning aggressive behavior as well. And wait, I was another presentation is here. Sorry, I was adding another one. Yeah, this will be. I'm sorry. As we said, there are various publications indicate that the heavy metal exposure has increased the tendency to crime and violence, especially in adolescence term. According to these studies, there is an increase in the frequency of social introversion, depression, atypical body movements, neurological problems, aggression, sleep disturbance, even substance abuse and the forensic incidents in those who were exposed to heavy metals in perinatal or postnatal period. So that's mean when you expose it to heavy metal in this, especially in neonatal period, you have this kind of the problems. Although there are studies on determining the heavy metals level in children in our country, in Turkey, there is no specific study to adolescent age group. Especially in Europe, we couldn't find any interesting study on the focused on the adolescence level. So we decided 2 years ago, we decided to focus on the adolescent aged. As a result of the study, we aimed to determine the correlation between the heavy metal level in blood, plasma, and urine, and the aggression level of the adolescents. So that's mean we aimed to that. If the adolescents gain the heavy metals, how their mood change? Are they aggressive or they still have their normal life? As you know, the environment is one of the most important factors affecting the human health, and it is estimated to account for about 20% of all deaths worldwide. I want to underline that again. 20% of all deaths is caused by environment. So it is important. Repeated exposure to environmental toxic substances may be beginning in the intrauterine period and continue throughout the life. According to the WHO, World Health Organization, 1 in 4 child deaths, 1 in 4 child deaths can be prevented by reducing the environmental risks. What does that mean? If we come together and prevent focus on the environmental health and adolescent health, we can prevent the 1 in 4 child from the environmental deaths. In 2012, 1.7 million deaths in children under the age of 5 were attributed to environment. The top 5 causes of death among the adolescents worldwide are accidents, HIV virus, suicide, lower respiratory tract, and the violence. It is important, my friends. The top 5 causes of the deaths of the adolescents is one of them is the violence. And what we said before in our slides, heavy metals can cause us a violence, aggressive behavior for adolescents. So why adolescents are important? So why we give the importance on the adolescents' health? As I said, WHO giving an importance on the adolescents, and they define the individuals with an age ranged between the 10 and 19 years as adolescents. So in pediatrics group, we group the adolescents age between the 10 and 19 years. On the other hand, in the last 2 years ago, Lancet introduced that in United States of America, they said the adolescent age group should be between the 11 and 24 years. So they expanded the range of the adolescent age group. So when we continue about the WHO defines, approximately 1.2 billion adolescents live in the world, and in some countries, adolescents make up a quarter of the population. This population also constitutes a large group that is ignorant and neglected. This is important. This is a large group, ignorant and neglected in many health systems. They don't recognize the adolescents and their health. It is known that an estimated 1.2 million adolescents die each year from preventable causes. Adolescence is a period that begins with sexual and physiological maturation caused by physical and emotional process and ends with the individual gaining independency, a sense of identity, and social productivity. During this period, rapid development changes occur in biological, physiological, and social field, and difficulties specific to this period may be experienced. Some risk factors that may increase the aggression, and which one of these difficulties encouraged in adolescents have been identified for several years. Among these factors, heavy metal toxicity caused by environmental pollution, the importance of it, which has recently been understood, is highly effective in promoting violent behavior. Reports have several articles, research demonstrated that heavy metal levels increases in adolescents with violent behaviors is parallel to their violent tendency between them. Due to the higher toxicity and widespread use, lead, mercury, cadmium, and manganese are among the heavy metals that are important for the public health. What we did in our study. In our methods, 2,228 adolescents between the age of 13 and 19 who applied to our university, Digital University of Faculty of Medicine, participated to our study. First of all, we agreed that we take the permission for their parents, and aggression scale which liability and reliability standard conducted was done. Later on that, we took the example from blood and then the urine, and we separated the plasma from the blood, and we studied 3 different examples from these adolescents. And we took the questionnaire about their smoking situation, about their tendency to do violence, and their aggression scale. And later on that, we concluded that the study. When we look at our result in our study with a total of the 228 participants, 55% of the participants were women and 44 of them were men. The average age of the participant was 15. Considering the distribution of the regions where the participants were living the southeast of the Turkey mostly. And according to the results of the analysis, lead blood, lead plasma, lead urine, mercury blood, mercury urine, and manganese blood, manganese plasma, and manganese urine were positively associated with the tendency to do aggression. What does it mean? We concluded that if these heavy metals increases your body, adolescents can be more violent and can show the more aggression lifestyle and other related complication about the heavy metals. Our study underlined that. According to that, as the level of the lead, again, mercury and manganese increases in the body, the tendency to aggression increased. In general, there was no significant relationship with other materials. When we concluded our presentation, according to the results of our study, general aggression tendency increased as a level of the, as I said, lead, mercury, and manganese in adolescence. However, there was no other relationship that we concluded. And we should underline that there is undeniable relationship between the child health and environmental pollution caused by heavy metals. For this reason, it is vital for public health to take necessary measures to prevent the environmental pollution caused by heavy metals. Thank you so much. Yes, that is the presentation we concluded then. Yeah. Thank you for, again, if you have the question that I can answer right now.
Thank you, Dr. Süleyman, for this presentation. I would like to ask to address the audience if they have any questions for Dr. Süleyman. So I think